I decided to come to the Practice EBD session for a couple of reasons. Certainly, first and foremost, it's a tremendous opportunity to meet and network with the most experienced professionals and to hear about their expertise and to gain more knowledge about projects and current evidence and research. But I think it was also really important for me to not only have the strong basis of understanding the process, of course, that's involved, but the greater challenge, I think, is understanding how to apply that process to each individual project. And so, as an independent consultant who works in a variety of different medical settings and with different clients, it's really important for me to understand how I can look at the unique opportunities and challenges within each project and then apply the EBD process.
We're a big construction company with the vision of bringing added value to the client, and our client is it could be a healthcare facilitator, especially in Canada or UK that we do that. So we believe that the added value of evidence-based design for our client and for ourselves is so valuable that we have to look into it deeper, same as any added value that environmental friendly or lead can bring to us. So we always look up to these things to be able to be ahead of the market always as a leader.
On future projects, I'm hoping to incorporate more rigor and use the existing evidence in a way that really serves the goals of our particular projects. I think there's some great information out there, but in the past I've come across that much of that evidence by accident, by the journal I happened to pick up, but we've had no real organized approach as to how we go about looking for the evidence that's available to us. And I think we've reinvented the wheel in many cases and redone things that we could have had access to fairly easily and really focused our resources on some other questions that needed to be answered.
I am assisting with a project that will be completed in a few short months, so time is certainly of the essence in terms of understanding what and how to conduct research. And so this has really helped me to focus not necessarily just on the research piece that we're going to pursue, but how to structure the information in the process in a way that I can present it to the client and gain the support of their team members and leadership so that they all feel a vested interest in pursuing those outcomes. I've learned today, certainly again, it's reinforced that EBD is not a prescription, that it is a process. I've learned that it is so critical to stay current with the evidence and research that's out there so that your time and resources are invested well, so that you're not reinventing the wheel and so that you can learn from what others have invested their time in pursuing and understanding. I've also just again had a wonderful opportunity to connect with such knowledgeable people, and hearing more about other people's challenges and opportunities and current projects has helped to broaden my understanding of what I could be looking at and the scope of opportunities for research within my own projects.
That's very important to see that people are sharing this information. It's not just this is my information, you go through the same process and figure it out. I'm very impressed with that. I'm impressed with the with having the mentor beside me and asking me the right questions, obviously, and making me kind of like challenge myself, coming up with the with the answers to those questions, and I'm very impressed. I'm very happy about this session so far.
Well, it's been great today having this one-on-one experience with someone who has a lot of experience as a practitioner as well as an academician, and she's just been very insightful and really interesting to talk with about projects and how I might look at them differently in a way that really uses the evidence-based research that's available. I think one of the things I'm learning through understanding more about evidence-based design is how closely it ties to lean, to the lean approach that our organization is taking. So it's a very, very good relationship between lean and evidence-based design. It's that plan, do, study, act, and really learning from evidence and making readjustments and continuing. So.